Don't neglect the signs that the prostate gland may be giving you afraid, shame, or conceivably even perhaps unawareness. Many males tend to overlook certain indications that the prostate gland starts to give, notifying that she is not doing very well. Thus, today I would like to teach you the 5 main signs that the prostate starts to show in men so that you can have this knowledge and search for aid. Hi, I'm Dr. Tiago and I'm a doctor, urologist here in São Paulo. The initial indication is an augmentation in urinary frequency. Although it is a common occurrence from a particular age onwards, the man to have a slight increase in this urinary frequency, we need, yes, discard the possibility of it being a prostate problem. Prostate, it's an organ located right at the exit of the bladder, and it possesses a function that is solely and exclusively focused on sexual activities. She makes semen, but it is right at the beginning of the canal. The prostate is the first part of the urethra when considering from the bladder to the penis tip. And while experiencing benign prostatic hyperplasia, which initiates the well-known enlarged prostate, she begins to make emptying the bladder difficult. This leads that the bladder needs to exert more force to empty, and this causes the bladder to become more sensitive, making it so that before she stored 400 mg, she starts to store only 200 to 300 mg. This is indeed a symptom of benign prostatic hyperplasia. More men who have an enlarged prostate can start having an increased urinary residue. Briefly, the bladder capacity is 400, but you go peeing about 100, so you just need 300 milliliters. To be able to fill again, this will be in shortest, so you experience an increase in the frequency of urination. Second symptom, start waking up at night to urinate. Again, there are several reasons for this to happen. Video here on channel, watch, that I exclusively talk about this. Watch there. I'll leave rec here at the end of this video. But yes, discard prostate problems. In these cases, at night, our body tends to produce less urine because in sleep, we produce a hormone which reduces urinary production exactly to avoid waking up at night to pee. However, if your bladder capacity, and if this is causing a problem, if this capacity is reduced due to prostate, you commence waking up at night to urinate. Is that correct? So in case you did not wake up during the night, began waking 3, 4, 5 times, this is an indication that something is not functioning properly. Therefore, search for a urologist to have your evaluation conducted or performed. Prostate, combined. The third sign is marked by hesitation or uncertainty. What's this? You know, when you really need to pee and you get to the bathroom and the urine doesn't come out. That is hesitation. It's that time when you arrive there at the toilet, ready to urinate, but urine doesn't come out. The name is hesitation. This is a very characteristic symptom, benign prostatic hyperplasia. Why does this occur? Due to a failure, a lack of relaxation of the prostate muscles caused by the swollen prostate because of the condition known as benign prostatic hyperplasia. So usually if you feel like urinating, you to go to bathroom and peed, evidently there is a psychological problem behind patient struggle, many, e.g. urinating near other men, of urinating in shared bathrooms. And there's a psych issue. This reluctance is a consequence of a variety of social factors and influences. Is not caused by hyperplasia, but rather due to not being able to relax, psych reasons. But if you're alone, no difficulty, and this happens frequently, this should indeed be researched. Prostate problems, mainly benign prostatic hyperplasia, prostate enlarging, or the famed prostate. As I've said in this video, needed to pee, rush to the loo, relax and pee. If you're taking a while to pee, ESP was when bladder is very full. Seek a urologist to evaluate your prostate. Combined, the fourth sign is the stream that gets interrupted during transmission. What's this? When we go pee, our urine, man's usual starts with jet, keeps growing. Quickly the strength, and then towards the end he starts to fall. That's what happens when we put this flow in a graph that we call a bell curve. So it has to be a continuous stream, cannot have interruptions in the middle. So when a man starts having prostate problems, as he begins to experience an enlarged prostate, this jet, like the prostate, obstructs the canal. He must try more than usual to urinate. This stream starts to become interrupted. He pees, stops a bit, pees more, stops less, urinates a little more, and stops. Symptom of benign prostatic hyperplasia. If your stream isn't continuous, seek a urologist, assess prostate condition, combined. And the fifth sign is a less strong stream, a symptom that people usually already associate, right? Prostate, crucial to emphasize, okay? The stream of menfolk, clearly when compared to you younger individuals, the jet at 40. 50 years old will indeed be slightly more weaker, but it can't be on foot. The urine stream, he needs strength there. You are required to make a slightly larger turn, and it is not possible to have a weak stream. It can't be a thin stream. The stream needs a medium force. Then when they own tech, we have tests to measure the flow of this jet it is recommended that this flow, a test called uroflowmetry, it reaches over 15 mil per second. That would be normal. Below 10 mil per second, we consider it a weak stream and probably caused by some blockage. Prostate. Emphasizing these signs is vital. They're often unrelated to prostate cancer. Prostate cancer is a disease on its own. It is vid. It's another topic. Symptom. They are more frequently related. Non-malignant enlargement of the prostate, which is the swollen prostate. Thus, if any symptoms, seek a urologist to assess the condition of your prostate gland there. I trust you had a pleasant experience. Please leave a comment below if you have any of these symptoms, if you treat any problem with your prostate, and don't forget to like this video and subscribe to the channel. Also, hope you had fun. I am Dr. Tiago. Till the next vid.